healthcare facilities and providers that we touch, I'm very sensitive to what they need from us, and I have never had an experience before Ensemble where I feel like I'm making such a difference.
Hey everyone, it's Julie Roberts. Welcome to Operator Insights. And today with us we have Beth Estrada, who is the Director of Revenue Recovery for us here at Ensemble Health Partners. Beth, thanks for joining us today.
Thank you for having me, Julie.
Well, let's just start off with an easy question. Tell us what revenue recovery is.
Revenue recovery is the division of our organization that can look at a health system's revenue cycle from tip to tail and find evidence of leaks and losses in that system, and then help recover that money for the system while also showing them best practices and ways to avoid that leak.
That's a good lead into my next question, which what is the value of performing revenue recovery for our clients?
Well, the value is really twofold. There's the realization of that revenue that's lost, and there's also the knowledge that a client gains from our feedback to them. Knowledge is powerful, and the leadership in healthcare organizations these days, they have a lot going on, so they don't always have the time or focus to give to the nuances of the revenue cycle where they could just be seeping money or even larger areas of loss.
What about how did you get into this work, right? So there's lots of revenue cycle jobs and roles that are out there that people have no idea about, right? You know, if you're a patient access registrar, folks know what that is, but how did Beth get into revenue recovery and make this her career?
Well, that's a long journey. I have been in the healthcare field for over 25 years. That tells a little bit about my age. I've dated myself. I started out in outpatient physician offices and clinics, and building from the ground up practices to make them successful. And along the way, you become very sensitive to the challenges that providers experience in building and growing and sustaining a healthcare resource in their community. I did spend a couple years within the on the payer side, recovering lost dollars in all the ways that you can conceive that a payer loses money when they pay a claim erroneously. And nothing has been more satisfying for me, however, than coming back to advocating for healthcare systems, for the providers, for patients and communities, and making sure that they have and sustain their healthcare resources that anchors in the community and have the services that they need.
So you've been doing it for a while.
Yes.
And here at Ensemble, you've been here for about 5 years now, right?
5 years this month, yes, ma'am.
And during that time, we've had just explosive growth. So let's talk about how you have built your team of folks under you and that you're able to kind of sustain that growth that we've seen.
Absolutely. I have an amazing team, blessed with individuals that are very, very passionate about what we do. The average tenure is, at least 10 years in the healthcare industry. Many of them have been hands-on in hospital revenue cycles. Some of them have also spent time on the payer side adjudicating claims. In aggregate, we have just a very deep bench of players that are really passionate. We understand that the margins for a health system to operate are very, very slim. And we embrace Ensemble's principle that we can change healthcare. And we really feel like we are doing that with the work that we do in revenue recovery.
Great. So when you talk about the team itself and sustaining that growth, if someone is out there wondering, could I do revenue recovery work? What are some of those things that you look for in terms of talent and skill set to add to your team?
Oh, wow, that's a great question. Revenue recovery, as a revenue recovery specialist or analyst, really looking for folks with a keen attention to detail who can pick out trends and patterns in behavior. Also looking for folks who are not timid. What we do is a lot of blocking and tackling for our clients. So we need to be confident in our conversations that we're having and just thinking critically about every scenario that comes before us. I'm I'm looking for those type of skills. And, people sometimes ask me, do I need to have healthcare experience? I would say that having healthcare experience is definitely getting you ahead of the game. It's a leg up, but it's not necessarily the end all. We have some folks who've started at entry level type positions and have a skill set that has empowered them to quickly embrace what we're doing, what the mission is, and be successful and grow from there.
Great. The folks that do the work for you, do you typically only suggest that the work that you do is for organizations that are struggling, or should the work that you guys do add value to an organization that's maybe not so sure if they have such revenue leakage?
Well, I think that we add value across the board. Certainly, if a healthcare system is struggling, you need some help right away. And if you're not sure, then you probably need some help right away. But even if you're a healthcare system that feels like you have a very healthy revenue cycle and everything's going well, my team can still add value. We're looking at issues that originate in patient access all the way to post-adjudication and appeals and denials. So if there's a symptom in your revenue cycle, we're the perfect diagnostic tool to help diagnose where that problem is and help you shore it up.
In terms of that diagnostic testing that you do, what is the feedback process, right? If I'm a provider and I've called Beth and her team to come in, how will you communicate with me on findings or opportunities or behavior changes that need to occur?
Certainly. Well, it starts with an assessment. So we provide an assessment to a healthcare organization, and then we move into the operation. We actively pursue those recoveries. So sometimes just through the pursuit, critical conversations arise, and a client is able to get some valuable feedback along the way. But at minimum, we conduct a monthly operational review. We summarize our findings, and then we provide root cause analysis and detail. And we share the playbook, like our CEO says. We share the playbook and give the client our feedback on best practices to mitigate those losses in the future.
If you were going in for an assessment, what are some data elements, those KPIs that you instantly pull to understand and get a temperature check at that particular client site?
Sure. So one of the things that's very helpful is to know what the payer mix is for a particular facility. Need to know how that's distributed across their revenue cycle. It's helpful for us to have the contracts so that we can see what the facility has agreed to in terms of reimbursement. We need, of course, data and access to data so that we can review against contracts and be able to tell how the payers are performing in their legal obligation. And then we just work backwards from there.
Great. In terms of the work that you guys do for both full outsource clients and point solution clients, does the work that you do differ, or is it the same work that you do in revenue recovery?
I think at the core, it's the same work. We're about finding the problem and fixing it. And I think that that is evenly true across both our full outsource and our point solutions.
So Beth, tell me about your ability to look across trends across the country, right? Ensemble serves clients across this beautiful country that we have. How are you guys able to find and locate trends and then tie that back to anything that may be happening regionally with payers? Is that work maybe that you look at and help solve for?
We definitely try to trend and track things that could occur nationally. So for payers like Medicare and Part C payers, there are certain trends that we can identify regardless of your geographic location. We also look regionally, and part of the success of Ensemble is our ability to communicate across our teams and across our service lines. And so we learn from each other. If we go into a new region or a new market, and we have a presence there in another service line, we look for that feedback from our other service lines. We communicate up and down and sideways. We track opportunities. We have hit lists. We go back through and make sure that we are checking for all the signs and symptoms of an unhealthy revenue cycle.
Great. You talked a minute ago about the communication, and talked about great communication internal to Ensemble. Who are the groups within the revenue cycle that you speak with the most in terms of getting that trending, working closely, to resolve those particular issues?
Sure. Well, it's not uncommon for me to reach out to my colleagues in the AR sector or our Epic implementation team or to our contract management team. Wherever we need input, Ensemble has resources and encourages us to communicate and share. And so I highly value all of my colleagues in all of those different fields that make it easier for us to be successful and our clients to be successful.
Great. So if you had to talk to anyone about your team, what would you want our audience to know about your team and the team members that you have supporting them?
Well, again, my team is very passionate. They take their jobs very seriously. They also have a capacity to love each other, love within our company, and love the communities where we operate. They're very experienced and knowledgeable and curious, and they're just a great group to work with. They're a very supportive team, and I can't imagine working anywhere else.
Well, that's great, because that leads me to my next question, which is, why do you work at Ensemble Health Partners?
Well, because Ensemble Health Partners is the best place to work. There's just a feeling of that you're making a difference. I grew up in a small town where we had one hospital, and that hospital was the sole source of health care for the community, but also community programs and education. And quite honestly, they were the employer for many of our friends and neighbors and family. So to me, the healthcare facilities and providers that we touch, I'm very sensitive to what they need from us, and I have never had an experience before Ensemble where I feel like I'm making such a difference.
Great. All right, Beth, so let's ask a fun question off the cuff.
Okay.
If you had access to a billboard and can put up any message that you want, reaching any audience, what would that message be?
If I could have a billboard that reached any audience, every audience, my billboard would say, rule number 1, love thy neighbor. Then rule number 2, everybody is your neighbor.
Very nice. Love it. Thank you.
Thank you.
All right. Well, Beth, thanks for joining us today. And why don't you do the outro for us?
Sure. Thanks for joining us. Be on the lookout for additional operator insights.